Again, as we get older, so do the risks associated with providing medical and dental care to aging population. Patients who have complex medical histories and extensive drug therapies can present a wide variety of challenges for the dental team. The dental assistant must be able to recognize an emergency situation and have the ability to give proper care or prompt care when needed. Again, health history is key. You need to try to prevent these from happening if you can. So it is medically and legally required that a patient fill out a medical and dental history. Once in the treatment room, the dental assistant should review the medical dental condition with the patient and check the accuracy, because sometimes patients, again, they don't want to check everything off and they'll leave some blank, and if anything's blank, we have to check with the patient. You left this one blank, why is it blank? What's the answer? If you find anything that you think is significant, make sure you mention it to the dentist, again, because sometimes the dentist is jumping from room to room and may not have the time to really check as thoroughly as you did, and you need to be able to maybe point out something that he may miss. To determine if there's any significant health conditions that may be impacted by dental treatment. To determine if any medications that the patient is taking may negatively interact with local anesthetics. These are some of the things we need to identify. To determine if the patient has any allergies to medications, like a lot of patients are allergic to codeine or penicillin, sulfa drugs. To obtain a contact person in the event of a medical emergency, and this is important. Again, the risk of it happening is not likely. Knock on wood, I haven't had any major emergencies. A few people faint, but other than that, nothing major. Knock on wood. But we always need to be able to contact somebody in case of an emergency. Emergency equipment. All offices should have an emergency kit, which we do, oxygen delivery system, and an automatic external defibrillator readily available. The emergency kit should have, and these are the basic drugs, there's some that can get really complex, but you should have epinephrine. And this is basically what's in the anesthetic, it's epinephrine. And if you have an adult or pediatric, you should have an adult and a pediatric dose available, used for treatment of anaphylactic reaction and life-threatening and allergic reaction. Okay, and the video will go over some of these real quick. Diphenhydramine basically is Benadryl. Again, for not an immediate response or an allergy, it's if a patient is getting a rash or something in the chair, but they're breathing okay, you can give them a shot in the muscle, just of Benadryl, instead of having to give them epinephrine, which is a life-threatening one. Nitroglycerin, anybody having heart pain or angina, it's called. It's either a spray or pills that they can take. Bronchodilator basically is for asthma, albuterol. Sugar, whether it be like icing, cake icing, or orange juice or something like that you should have. And aspirin. Okay, sometimes the patient that begins to have a heart attack, they say that they should chew a tablet of aspirin. Not swallow it, you got to chew it and then swallow it. Oxygen, you should have oxygen available. And then an automatic defibrillator, which you guys covered earlier. And everybody should be trained in CPR. And if anybody has advanced or be able to use the automatic electronic defibrillator. Every 2 years, you guys covered. The emergency team, I think that your instructor probably covered it. Whoever gets there first is usually the #1 team member, and he'll start calling names or for people to go call 911. You go get the oxygen, you go get the emergency kit, you go call the doctor, if the doctor isn't there. Team #2 hears the call for help, gathers other office members, brings the AED, drug kit, and oxygen to the scene. Team #3, if there is, all remaining team members are team #3. These members call 911, await for the ambulance, bring them back, and just be there in order help out if anybody needs, again, if you're doing compressions, to come in and help, or if somebody will tell you to go get something. But again, everybody needs to be alert in case of an emergency. If you should need help, call for it, never hesitate. Okay, this is where we'll start. Can you turn off the camera there, Don?